Hi, my name is Emily Purcell. This is my PowerPoint presentation for Chem 2773. My topic that I was assigned is metabolic diseases or disorders. And firstly, I would like to start by looking at what metabolism is and looking at some common pathways, metabolic pathways that we've talked about in previous courses and in this course. Then I want to give a description of what metabolic diseases are and what they include. And then I wanted to look at some common metabolic diseases that you've likely heard about, and then also look at some rare genetic ones that you probably haven't heard of before. For the two common ones that I'd like to look at, there are preventative measures that you can take to kind of bypass getting or contracting these metabolic diseases. So I wanted to look at those preventative measures as well. But first off, let's talk about what are metabolic diseases. So metabolic diseases or disorders, I will be using those two terms interchangeably. Metabolic disorders are characterized by an interruption in the body's process of creating energy from proteins, carbohydrates, and fats, and this process is known as metabolism. Problems with certain enzymes or problems with certain hormones, which we will look at in future slides. So here I wanted to talk a little bit about metabolism in general. On the left, the picture is of glycolysis, and on the right, this picture is of the citric acid cycle, or the Krebs cycle, or the TSA cycle. There are a lot of names. And this metabolic pathway is one that takes place in our body, and it's one of the more common ones to talk about. But there are multiple metabolic pathways that all go hand in hand in the body. This is just one of them. So glycolysis, the main idea of glycolysis is that one molecule of glucose is broken down into two pyruvate molecules, two NADH molecules, and two ATP molecules. And those ATP molecules being your energy molecules or your energy source. The pyruvate that is produced in glycolysis can then be fed into the citric acid cycle once it has been changed to acetyl coenzyme A by the enzyme pyruvate dehydrogenase. So once that happens, the products of the citric acid cycle are one molecule of GTP or ATP, which are energy molecules, one FADH2 molecule, and 3 molecules of NADH. And these all can be used in further cellular respiration steps to produce more ATP or more energy. So we're really looking at the breakdown of substances into energy. Now I want to talk about some common metabolic diseases and their symptoms and risk factors that you've probably heard about before. First, diabetes mellitus. So there are 3 common types of diabetes. There are other uncommon types that are more rare, but I'm not going to touch on those today. I'm only going to focus on the 3 main types and then further into just one type, but we'll see that in a second. First, we have type 1 diabetes. This is an autoimmune disease, and individuals with this disorder require an external source of insulin. So what's happening is your immune system, or the individual's immune system, is destroying insulin-producing cells in the pancreas, and insulin can't be produced. Then we have type 2 diabetes, which is a metabolic disorder where the pancreas does not produce enough insulin and or the body does not use the insulin produced properly. And certain precursors make you more susceptible to develop type 2 diabetes. And this is the type that we will be focusing on while we look at metabolic disorders. The next type of diabetes is gestational diabetes, which occurs during pregnancy if high blood sugar levels arise. So you can develop gestational diabetes during pregnancy, and then after delivery, it usually goes away. But having that gestational diabetes during your pregnancy can be a precursor for developing type 2 diabetes later on. Now I want to talk about some symptoms of type 2 diabetes, and these symptoms are expected in a metabolic disorder, and I'll tell you why in a second. So we have increased thirst, numbness or tingling in the hands or feet, increased hunger, frequent urination, unintended weight loss, fatigue, blurred vision, and slow healing sores. And these symptoms make sense because your body isn't producing enough energy to sustain you. So you'll be tired, you won't have that energy. Your hunger levels will increase because your body will be telling you, I need glucose so I can break it into energy. But there is enough glucose in the body, it's just something's going wrong with that metabolic pathway and energy can't be produced. So now I want to talk a little bit more about how metabolism is involved in type 2 diabetes and talk more about insulin. So our bodies naturally produce insulin. It is a hormone that is used to transport glucose from the blood into the cell. So I have a picture here on the right showing how insulin works. Insulin goes into the insulin receptor on the cell, and this tells the glucose channel to open and allow glucose to enter the cell. Then glucose can undergo glycolysis and pathways like the citric acid cycle, and ATP can be produced and used by the body. But what happens in type 2 diabetes is sometimes this message from the insulin that tells the cell to import the glucose and open those glucose channels is simply ignored. And this is called insulin resistance in cells. So the cells are insulin resistant. They're not listening to what the insulin is trying to tell them. They don't take in that glucose, and so they can't convert it to energy. Also, with type 2 diabetes, sometimes the pancreas simply does not produce enough insulin for the body. And this means that there's just not enough insulin to fit into those receptors and let the cells know that they should be letting in those glucose molecules and producing energy. So there are some risk factors associated with type 2 diabetes, and we'll see in future slides that these risk factors also play a role in other metabolic issues. The first is like a lazy lifestyle. So I have a picture of a girl on her computer laying down. If you don't get a lot of physical activity, your body can't use that glucose as an energy source because it doesn't need it. You're just laying around. You're not doing anything that requires energy. It also, being physically active, encourages your cells to get used to hearing those insulin cues and not developing insulin resistance. Another risk factor is obesity, so simply being overweight, and fat distribution. So if you have a lot of abdominal fat or visceral fat in your stomach, you're more likely to develop type 2 diabetes. The waist circumference that is a risk factor is above 40 inches in men or 35 inches in women. Another risk factor is family history, and also race and ethnicity fits with that. So with family history, if your genetics are telling your body that you're predisposed to developing type 2 diabetes, then you're more likely to get it. With race and ethnicity, Black, Hispanic, Aboriginal, Asian, and Pacific Islanders are more likely to get diabetes than white people are, which is really interesting. I'm just gonna take a sip of water. Another risk factor is age. So if you're over 45, your risk of developing type 2 diabetes increases, and also the risk simply increases as your age increases. If you have prediabetes, so if you have a blood sugar level higher than normal but not high enough to be considered diabetes, you can develop type 2 diabetes later on. And again, pregnancy. So I talked a little bit about gestational diabetes, and if you undergo gestational diabetes during pregnancy, then after delivery, once that has gone away, which happens most of the time, you are more likely to develop type 2 diabetes later on down the road. If you have polycystic ovarian syndrome or PCOS, just having this condition increases your risk. And if you have darkened skin on your neck and or armpits, this is a sign that your cells are undergoing insulin resistance and they're not listening to those cues that the hormone is telling them. So moving on from diabetes, I'd like to talk about metabolic syndrome, which is a syndrome that kind of encompasses a lot of different issues in the body. So it's described by the World Health Organization as a pathologic condition characterized by abdominal obesity, insulin resistance, hypertension, and hyperlipidemia. So abdominal obesity, I had already mentioned that visceral obesity, having your waist circumference over 40 in men and over 35 in women. Insulin resistance, where your cells aren't listening to the insulin and not letting glucose in. Hypertension, which is high blood pressure. And hyperlipidemia, which is when your blood contains too many lipids, such as cholesterol and triglycerides. So on the right there, I have a picture. It shows how the visceral obesity, the high blood pressure, low HDL cholesterol, which is the good cholesterol, hypertension, and high triglycerides all come together to form the encompassing syndrome, metabolic syndrome, or MET-S. So why is this important, and why do we care about metabolic diseases or disorders in general? So because metabolic syndrome encompasses an assortment of conditions such as hypertension, hyperlipidemia, visceral fat, all of those things, it's important because all of those conditions are kind of working together. So if you have high blood pressure, you're more likely to be obese and you're more likely to have hyperlipidemia, and all those things are coming together. So a lot of people are impacted by these metabolic issues. Around 1/3 of adults in the US have metabolic syndrome, and metabolic syndrome affects around 1/3 of women with PCOS. So this issue is affecting a lot of people. And it's only becoming more prevalent as issues like obesity and high blood pressure become more common. This is due to people eating more poorly, eating more fast food, having these foods rich in salts and sugars and carbohydrates and fat more readily accessible to them. As a society, we're just eating more junk food and also not exercising as much as we should be. So again, we are more likely to be sitting on our laptops or on our phones than being physically active. And as that happens, and as more people stop leading physically active lifestyles, this syndrome will affect more people. So, how is metabolism involved in metabolic syndrome? I already had talked a little bit about the insulin resistance and how that plays a role. Now I want to talk about how obesity and hypertension can play a role in this metabolism in your body as well. So with obesity, your body is consuming more than it is needing. It's more than is necessary. And all of this excess is stored as fats and carbohydrates, and your body simply can't keep up with the AT production needed to break down all of these glucose molecules and fats. So they accumulate in the body. With hypertension, having high blood pressure affects heart metabolism. So On the right here, I have a picture of a simplified picture of cardiac metabolism in normal conditions. So your heart, in your heart, long-chain fatty acids and glucose are broken down to produce ATP, and this helps contractile functions in your heart pump blood. So when you have not a physically active lifestyle, and when you're accumulating all of this glucose and carbohydrates and fats, your body can't keep up with it. It really puts a strain on things like cardiac metabolism, and that's why your heart health can deteriorate more quickly with issues like having issues like high blood pressure and obesity and such. So your body really feels the strain from all these things. Some other examples of metabolic disorders. I have a few here. These are all rare disorders and they're all genetic. So unfortunately, there's not much that we can do to prevent these disorders, other than when thinking about having children, going to see a genetic counselor and seeing if you have the genes that would predispose your children to be missing enzymes or not producing adequate amounts of certain enzymes. So, so first we have Gaucher's disease. Sorry, I gotta take more water. First, we have Gaucher's disease. Individuals with this disease are deficient in glucocerebrosidase, and this leads to an accumulation of glucosylceramide. This is a fatty substance, and it can accumulate especially in the spleen and liver. This can result in cancers like myeloma, leukemia, and lymphoma, and also other diseases like Parkinson's disease. And having this disease delays growth and puberty in children. So that's pretty detrimental. Another syndrome is Hunter syndrome. So individuals are missing or have a malfunctioning enzyme, iduronate 2 sulfatase. And individuals with Hunter syndrome are more likely to be boys because of the X-linked inheritance of the defective chromosome that's passed from the mother to her son to develop this syndrome. There is no cure, unfortunately, and because iduronate 2 sulfatase is responsible for breaking down complex sugar molecules, these complex molecules do build up over time because the enzyme isn't there or can't break them down. And this can lead to physical attributes like thick lips and an enlarged head. So what happens is the baby is born and they look fine. They don't have any noticeable physical defects. And then over time, these complex molecules build up, and that can lead to physical defects like an increase in your head size and thick lips. And this is noticed around age 2 or 3. So as the child is developing. Another metabolic disorder is Crab disease, where individuals produce little to none of the enzyme galactocerebrosidase, or GALC. With Crab disease, it's inherited when there are 2 copies of an altered gene, so 1 copy from your mother and 1 from your father. And because of the lack of this enzyme, there is a buildup of galactolipids, which destroy the myelin sheath surrounding your neurons in your brain and your nervous system. So it's very detrimental to the nervous system and nerve function. The next disorder I'd like to talk about is maple syrup urine disease, or MSUD, which is sort of a funny name, but I'll explain why it's called that in a second. So individuals with this disorder cannot break down amino acids. The amino acids are leucine, isoleucine, or valine. So because individuals cannot break down these amino acids, they build up and they become harmful. And this is more common, this disease is more common in small gene pools or when cousins or close relatives have children. And the reason why it's called maple syrup urine disease is because individuals with this disorder may have urine, sweat, and or earwax that smells like maple syrup or burnt sugar, which is interesting. Another example of metabolic disorders is Niemann-Pick disease. In this disease, individuals cannot metabolize fat properly, and this leads to a progressive loss of nerve function. It affects the brain, nerves, liver, spleen, bone marrow, and can even affect the lungs and breathing in rare cases. And this disease mainly affects children. Because unfortunately, a lot of children with these diseases don't live for very long. The next disorder is Tay-Sachs disease, where individuals cannot break down fatty substances called gangliosides. So again, this is a rare genetic disease. The child inherits the gene from both parents, similarly to Crab disease, in the fact that both parents are to play a role in this. And Tay-Sachs disease usually shows up at around 6 months old. This buildup of gangliosides leads to blindness, paralysis, and death, unfortunately. So all these diseases are very detrimental, and it's kind of sad that there's no prevention here, but you can see that just having a missing or a malfunctioning enzyme can play a big role in the way your whole body works. So now prevention. Obviously, we can't prevent genetic disorders, but there are some things that we can do to prevent getting metabolic disorders like type 2 diabetes and metabolic syndrome. And they're the preventative measures everybody's heard of all before. So the first thing is healthy eating. So when you eat healthy foods and you're not eating an abundance of fats and carbohydrates, you're putting less of a strain on those metabolic pathways, and you're helping your body to use the glucose and the fats that it has and break them down into energy, and to then use that energy in further processes like physical activity. You're using that glucose as an energy source, and you're training your pathways to recognize that you're going to do this often. You're going to use that glucose. It's going to make ATP. You're going to use that ATP and then eat healthy foods again. And using that glucose pathway frequently helps to prevent insulin resistance. So it helps kind of train your cells to recognize the signs from insulin to open up those glucose channels and to let glucose in so that glycolysis can occur. Another thing that you can do to prevent these disorders is to drink more water. It reduces your sugar intake and your glucose intake. You can also quit smoking because, interestingly, high levels of nicotine can weaken the performance of insulin. So if there are high levels of nicotine in your body, insulin can't work the way that it's supposed to, and it will. It can sometimes work in a way similar to type 2 diabetes, where the insulin can't let the cell know that it needs to open the glucose channels and let glucose in, similar to insulin resistance. So again, all these preventative measures are things we've all heard about before to prevent other disorders. Metabolic disorders is just one more thing that these things can help prevent. So anything that we can do to help use up the stored fat in our body, produce ATP, and get your body used to using up these energy sources helps to prevent insulin resistance. And metabolism is very important for an abundance of processes in our body. I talked about glycolysis and the citric acid cycle, but those are only 2 metabolic pathways that we've discussed in class. There are many more. If we are not able to produce or use even one specific enzyme or hormone, it can have huge negative side effects on our body. So that's why it's so important that if you can, you are really training your body on how to use these metabolic pathways frequently and not put too much strain on them. So I have included my reference pages and my thank you slide for the presentation template, and the link for my video will be here. I also wanted to let the marker know that I used some graphics from the template in the slideshow, and they might not come up in the slideshow, but hopefully you can see them in this recorded video. Thank you.